Hello, everyone. I'm Lori Moore-Merrell with the International Public Safety Data Institute, and I'm thrilled to be able to be with you to share some about changing the face of behavioral health and the impacts of technology. Today, I'll be speaking about presumptive law and the need for exposure tracking, particularly in the areas of behavioral health. So let's first of all start by talking about what is presumption. You all have heard about presumptive law, particularly in the arenas for cancer. In fact, we've been very successful at passing presumption in cancer for firefighters, right? And so having that presumptive link is key to benefit coverage and the link to the job. So let's talk about defining what presumption is first. So presumptive laws links a particular occupation with some disease or condition shown to be a hazard associated with that occupation. In other words, some hazard on the job contributes to or causes your disease. Now, as a result of this linkage, then, if an individual is employed in an occupation with a covered presumption, then that disease is presumed to have come from the occupation. And so in firefighting, again, we know most about this in the area of cancer, but we're starting to learn about presumption for behavioral health issues as well. So what are the requirements of the law for presumption? The concept is that the burden of proof is actually removed for the firefighter. So if there's a presumption in place linking that exposure to disease, there's no initial burden of proof on the firefighter. It is presumed that the disease came from a hazard related to the job. So there is no level of proof. Again, I want to point out initially. However, you have to still meet the requirements in the law. And often even when I was at the IFF, we were very hard to pass these laws, but we didn't do very well explaining what were the requirements within the law, because presumption is not carte blanche. And that's important that you understand. These presumptive laws have additional requirements with them. Often it is exposure tracking and providing evidence of exposure. So there are multiple requirements. Again, focusing on looking at cancer, we might see that there is no smoking. It might be related to your years of service, like a base of 5 years. If you get cancer prior to having 5 years on the job, then it would not be presumptive if that is a requirement. So there are multiple requirements within the law. Also a presumption, as I said, it's not carte blanche because it can be rebutted. Even though it is presumed that your disease, whether it is cancer or behavioral health, and we'll talk more about that in a moment, came from the job, it is not a guaranteed approval of your workers' comp claim. So presumption always allows for the employer or others to rebut your claim. Your insurance company can rebut, even if you're retired. And often we see cancers and PTSD in our retirees, right? And so that kind of coverage linked back to the job is very difficult, and it can even be rebutted by your pension plan. So there are many arenas where presumptive laws have the opportunity for rebuttal. And so we have to be very careful that we understand the requirements of the law, and again, provide evidence of exposure from the job when it is required. So what is that proof in rebuttal? If there is a rebuttal and that presumption does not carry through initially, then what is the proof that is shifted to the firefighter at that point? Now, there's two different levels of proof. And many of you have heard of these, in TV shows, for example. What is the preponderance of the evidence, or is it clear and convincing? So if a claim is rebutted, then the firefighter's counter arguments can become more difficult. And so having proof of your exposures to shore up your claim of presumption, right, for your disease is key. Now, these two levels can be defined as percentages, right? So preponderance of the evidence simply says that you've got greater than a 50% chance that your claim is true. Your disease or your condition came from the job. It came from being a firefighter or a paramedic on the job and your exposures. Clear and convincing is a much higher level. That's like a 99%, right? It's probable. It is much more convincing evidence and makes it much truer that the evidence that your exposures led to disease and they were related to exposures on the job. So if a claim is rebutted, unless you have in your presumptive law in your state where it precludes a rebuttal, right, and shifts this burden regardless onto the insurance, onto your employer, onto your pension system, right, that could be, and we're starting to see that in some of the laws. Arizona, for one, just had their law changed. But if that is not there, if that's not the case, and in behavioral health laws, we are not seeing that kind of shift. So a rebutted claim will shift the burden of proof onto the firefighter. So proof and rebuttal, you're going to have to show 3 items. One, that an injury or illness has occurred, that it occurred while you were working or related to the work, and that there is some link between. Now, the presumptive law obviously is supposed to remove that link. But again, if it is rebutted, then you may have to show that that link exists. So this 3-part test is part of that proof in rebuttal, should a rebuttal occur. Now, in behavioral health, we have several different areas that we can talk about presumption. So there are some states that already have laws in place. With these laws in place, we see some language like you see on the slide now. Firefighters routinely work in environments characterized by multiple risk factors traditionally associated with mental health, anxiety, depression, PTSD. Or you might see a clause that says the job is marked by high stress, sleep deprivation, low control, personal risk, right? Exposure to trauma and human suffering. So often we will see language like this correlated in a behavioral health presumptive law, and there aren't many of those to date. We are still working to try to move forward in many, many states. But I love this quote that I heard from one firefighter that said, "My mind can't forget what my eyes have seen." And I think that's the story for many of us. You remember vividly many of the things that you've seen on the job, things that, god-awful things that people do to each other, things that have happened accidentally or otherwise, human suffering. And it is things, these things that are not normal to us as a human, but for firefighters, they are the norm. And so understanding this presumption and the exposures that you have to traumatic events are key to presumption. So there are several states, as I said to you, that already have PTSD presumption, whether it is PTSD or mental health presumption. So that can cover things like depression, for example, anxiety. Often we will see firefighters with secondary conditions, that are attributed back to PTSD, like alcohol, drug use, right? You have all of these things, or you've seen them in your colleagues, perhaps even in yourself, but they are not necessarily a first, generation event. They are linked perhaps to a mental health condition from the job or PTSD. We also see a lot of states with benefit eligibility. So it's not a true presumption. It is a benefit eligible situation for behavioral health. So again, we're still working through many of the states to get better presumption for behavioral health for firefighters. So some example of other health exposure requirements: an exposure as a covered employee to trauma that meets the diagnostic criteria set forth in Criterion A in the DSM-5 for PTSD or acute stress disorder. Now, you may have never heard of Criterion A in the DSM-5. So DSM-5 is a diagnostic manual that's used by physicians and clinicians, particularly psychiatrists, psychologists, to diagnose PTSD or acute stress disorder. And there are certain criteria that they have to meet. So laws may note these criteria from this diagnostic manual or guide in the law itself. So if you are in a state where you have these laws, you should know what it says. What are the requirements, right? You have to have experienced trauma. That is one of the traumas listed, right? One of the diagnostic criteria. Or it may say is exposed to one or more traumatic events arising out of or in the course of the work. Well, you guys, we all know that we are exposed to many traumatic events. And we know in the fire service that often behavioral health situations are cumulative. It's not a one-off situation, right? And so Cumulative, however, even though we understand that, that is not part of the diagnosis. To be diagnosed, you have to be able to point to one event, right? So what caused it? Where was the cause? And so that is something that a lot of us don't understand either, that we can't go in and say, yeah, it's cumulative, although that's our story. That is what has happened, but your law will note this otherwise, right? So these are just a couple of examples out of a couple of different state laws that you might be aware of. So leading into technology, that's what we want to talk about. What is helping with our behavioral health situation using technology? So I wanted to tell you about the ENDORSED, the National Fire Operations Reporting System Exposure Tracker. The Exposure Tracker is a mobile app. If you haven't already downloaded it on your phone, please do so. It works on iOS and Android. It is free. It was developed with funds from the AFG Assistance to Firefighters grants, particularly in fire prevention and safety. And we're very grateful to FEMA for those grants that help us build this app. This app is key to you tracking not only your exposures to carcinogen and EMS bloodborne pathogens, COVID, and hazmat, but there is a traumatic event, or what we call the behavioral health module, in the app. In those traumatic events that you can record. Now, this does a couple of things. First of all, it gives you a record in your career diary of these traumatic events to which you've been exposed. It also helps you have a place to record it so that you can perhaps get it somewhat out of your head. You've put it somewhere else. And so that in of itself is valuable. So let's look at what's in this app for you. In the behavioral health module, it is based on a primary screening for PTSD. Now, it's a 5-item screen, although there are 8 different questions in the module. So you won't know initially which questions are coming from this particular instrument. But we leverage the National Center for PTSD and a validated test that they use for screening in the app. And so those screening positively, it does not mean you have PTSD. It means that perhaps you ought to talk with someone and have a more structured interview. So this is a very preliminary place to say, are these, are you experiencing certain after effects of a traumatic event to which you've been exposed? So here are some of the questions that are contained in the exposure tracker. So have you been constantly on guard or watchful or uneasy, easily startled after this event? Have you tried not to think about it or avoid situations, perhaps even smells that remind you of it? Have you felt numb or detached, right? Do you plan to talk to someone about it? Do you feel guilty or unable to stop blaming yourself because you couldn't do more? Things like that. So this is just a few of the questions that you will see in the app, and you will record these things and they stay with you in your career diary. No one else will be able to see your data. This is your personal database. It is secure. It's encrypted with your login. It lives in the Amazon web server, so it is in the cloud and secure there. We are looking at providing data beneficiaries so that if you did want to have a beneficiary, should something happen to you, heaven forbid, that you want to be able to get to your data, then that is something that we're looking to add to the app even now. But providing your login credentials to someone close to you that you would want to have access to your data. Otherwise, it is extremely secure. Again, no one gets to your data. You can, however, print it and use it to file a claim. And that's the whole point, is that you're keeping a log, a career diary, should you ever need it. Hopefully you won't, but if you should, and it looks something like this. So there is a list of your recordings. You can see the date, even the incident numbers that are there, and what were you exposed to. And so the list is there. The app is very user-friendly. It's pretty easy to click through. You can go back at any time and add notes. So you can see that you can edit these and add your notes, other thoughts that you may have about your traumatic events. So this is a secure place for you to keep all of your information throughout your career, and even into retirement. This stays with you. As I said earlier, many of us don't have that kind of mind thought process that is more intrinsic until after we retire, right? We are all so busy serving someone else. And so as long as you're busy, you're able to kind of squash all this down. Well, when you retire and you begin to think about this, then many of us experience those kinds of reoccurring thoughts from traumatic events from much earlier in our career. And so having a place that you can record these and keep them in perpetuity, should you need them in retirement, is very important. We also have in the app the National Suicide Hotline call number, the 1-800-TALK number. Very important that you have access. We also record in there for IFF members, there is the IFF Behavioral Health Center of Excellence number that you can call as well. And so we try to provide you some resources within the app that you can reach out and speak to someone else, whether it's inside your department or outside your department. I want to show you a little video just to talk a little bit about behavioral health exposures.
Firefighters see things that aren't normal, and they normalize them. And the impacts of that, you see it coming out in behavior, you see it coming out in use of drugs, you see it coming out in use of alcohol. Just last week, we responded to a 9-year-old under a bus. These are not normal.
We're seeing a higher incidence of divorce, of chemical dependence, drugs, alcohol, and just poor decision-making on people that are in the mid to later stages of their career. This is coming from people that typically wouldn't exhibit these tendencies or these character traits. When compared to similar age demographics in the non-emergency response environment, you don't see these things.
By being able to manage the things they're seeing, by being able to track the type of exposures they have, we may be able to get ahead of the curve to correct some of these things before they get to where they are.
So you can see how important it is to be able to record and have your own data within your own app that stays with you for life. Now, I want to mention COVID. So I know we're talking about behavioral health, but we also have a presumption for COVID. Now, in the Safeguarding America's First Responders Act, that presumption exists. If you look at the very last line, and it exists both for death benefits and disability benefits, but I want you to look at the last line, and I know this is a busy slide, but I want you to see the last line, a couple of lines here that says, the presumption exists if you have the resulting disability from COVID-19 or complications related to COVID-19 because of a sustained injury on the line of duty, right? Provided that you engage in the line of duty actions. Well, what that is saying is you're going to need evidence that this happened on the line of duty, the exposure happened on the line of duty. You were actually engaged in responding to calls during this time period, right? That is evidence of exposure. And so with COVID, why is this important to behavioral health? Well, we all know that we've had some additional stresses from the COVID lockdown, right? And all of the things that first responders have had to deal with during this pandemic. But we are only beginning to learn that there may be long hauler effects for those of you who actually had COVID that are contributed to mental health situations. A physiological link to a mental health situation. We don't know yet what we don't know about the long haul effects of COVID. So this is another exposure that you need to track in your career diary. So I just wanted to mention that to you because I think that's important that we understand. If you didn't know that link, it's important that you do understand and look at that link now. Now, we do have a lot of COVID presumptions going on at the state level as well. Some are for infectious disease legislation. Some we have some general infection disease legislation. Others are executive orders that you all know can be overturned at any time. Some are through labor departments, some just having introduced legislation. So the IFF, again, is continuing to track this, follow this, but every single one of these, without question, will require some sort of exposure evidence from the job. Again, presumed, but there will be requirements in the law. Presumption is often not carte blanche. Please understand the use of the technology and how important it is for you to use some sort of tracking I invite you to download the Infor's exposure tracker. Please make it that your personal career diary, your personal database. Keep the history of your work, your career or volunteer. Keep the history of all of your exposures, regardless of the origin or type. So important for you. We can also link that to try to reduce some of your data entry burden, to talk a little bit about technology. If your department is linked with our Infor's analytics, then we can provide you a secure incident access code that will automatically load the incident data in your career diary. In other words, you won't have to enter an incident number or address so that you have verification or validation of that exposure that you enter to show that it was actually linked to an incident. We can actually have that auto-loaded if we link with your department's CAD information. Again, that's a secure download into your app. It just helps you eliminate some of the burden of data entry in tracking your exposures in your career diary. Again, we are also working to make this link with other apps. So technology that will lessen your burden to make it much easier for you to record your exposures. So in Arizona, we have been working with the 100 Club there and with their Fireproof app. So those of you from Arizona, if you have the Fireproof resources, that has a lot of behavioral health resources already loaded for you, everything from personal wellness to mental health, a lot of physical fitness, we have been added to their app as well. So for your exposure tracking, you can actually access our app by going to the Fireproof app. So you'll need to download Infor's, go ahead and set up your account, set up your profile, and then you'll be able to go into the Fireproof app and you won't have to open both, just one, and then you'll be able to access. So we'll continue to work with other states and other foundations that provide mental health resources so that we can link and become the exposure tracker for you, but be part of this ecosystem of technology that is trying to bring you better resources for exposure tracking and for resources to help you on a day-to-day basis. So with that, I want to provide you my contact information. We'd love to hear from you, love to hear from your department. We are also connecting with the National Firefighter Registry for Cancer. So I know today we're talking about behavioral health, but we want to make sure you're tracking your exposures for all aspects of your career so that you have your evidence, you have your data, should you ever need it. Thank you so much for your time today. I've enjoyed presenting with you. I look forward to seeing all of you soon. Take care.
Hi, I'm Dr. Dave Black, founder and president of CORDICO. I'm also a clinical psychologist who's been working with firefighters and other first responders for nearly 20 years. I'm very excited to talk with you today at this very important conference at what I think is the most important issue facing the fire service today, which is firefighter behavioral health and wellness and how we can address this issue at scale for firefighters throughout the United States. So I'm very excited to share this with you today. This is how we've been changing the face of behavioral health for firefighters across the United States, is designing customized mobile wellness apps that firefighters can utilize to access high quality wellness services during their moment of need. And we've had great success with this. So just quick backstory. Firefighters, of course, are exposed to extraordinary levels of trauma. We often refer to these as critical incidents, incidents that overwhelm a person's ability to cope. What people often don't take into account is the fact that firefighters are amongst the most toughest, resilient people in our society. Almost no one is cut out to be a firefighter. You have to be extremely resilient and tough to do this work. But then what we ask of firefighters is that they respond to everyone's emergencies 24/7. And so they are exposed to a level of trauma that's absolutely unparalleled in our society. And as a result, despite the toughness, despite the resilience of these individuals, 75% of our firefighters report unresolved emotional issues due to job stress. So virtually all firefighters are carrying some sort of baggage emotionally, and that's just not fair. This results in, we know from research, of course, post-traumatic stress, and you get increased risk for post-traumatic stress with additional trauma exposures. It results in increased rates of depression. Both post-traumatic stress and depression are associated with, of course, increased risk for suicide and also with decreased life expectancy. Firefighters also report, the majority of them, being easily angered. The majority also report experiencing family problems. The majority report experiencing sleep problems. And far too many firefighters report experiencing suicidal thoughts. The rates of suicidal thoughts vary according to the study within the firefighter population. But what's clear is that it's far beyond what you would anticipate given population norms of suicidal thinking in the general population. Keep it in mind that the general population suffers from fairly high rates of mental health disorders. They don't have the toughness and resilience to be firefighters. So when we see rates in the firefighter population that go well beyond what we see in the general population, those are big red flags for us that we have to take this issue more seriously. And of course, chronic stress, which firefighters are all exposed to through sleep deprivation, through trauma, critical incidents, and then the compounding effects of those elsewhere in their life, as we've just discussed. This, of course, leads to unhealthy coping. This is where you see people turning to junk food, turning to alcohol, turning to ways of coping that are unhealthy and further compounding the problems. So what do we have in the way of a solution? Well, first we got to understand, why are firefighters unable to get help under current circumstances? Well, the vast majority report that there's a stigma in the firefighter profession that prevents them from getting help. And we know that this stigma exists through very sound research that's been conducted. It's close to 9 out of 10 firefighters report that there's this stigma that would prevent them from getting help for emotional or behavioral issues. This is the double-edged sword of having a population of individuals, firefighters, who are so tough, so courageous, so resilient. It creates that culture of strength, which we have to have in the firefighter service. But what that does is it also creates a barrier for firefighters being able to raise their hand and say, hey, I do need some help at this point. And that's a problem, because when you have someone who needs help and can't get it, that's where crises emerge. Why does this stigma persist? A lot of it has to do with fear of being seen as weak or somehow unfit for duty. And as a result, the large majority have never utilized services that are available, such as EAP services, for example. Here's the thing, though. Of the percent that do go and take the big risk and utilize those services, there's really been a failure on a national scale that the clear majority have found those services unhelpful, unbeneficial. So when we understand the barriers to getting help, it helps us better understand what a solution should look like. So that's what I'm excited to share with you now. This is how we've been helping. We provide confidential access, so that decreases stigma because I can access these resources confidentially. We provide them 24/7 in the hand. So whenever the firefighter needs assistance, it's right there in their hand. Exceptional quality, meaning we tailor and vet the resources specifically for firefighters based on our experience and expertise working with firefighters. We customize these specifically to the firefighter population and their spouses and significant others. And then we frequently update them, so it's constantly engaging and new material. So we customize these for different agencies because what they have at CAL FIRE is going to be different for what they have at a small fire department in the Southeast, for example. So every fire service agency is different, and so the resources are customized to them. It's also customized in terms of the look and feel to help further the culture and strengthen the brand of each fire service agency as a leader in firefighter wellness. And then what we put in these apps includes anonymous self-assessments. One big problem we find with firefighters being able to get help for emotion and behavioral issues is that these issues aren't as clear as physical issues are. For example, if I have a shoulder problem, there's no stigma around that. And it's easy to go to the doctor and point and say, Doc, I got an issue with my shoulder. And okay, rate your pain. Let's assess your mobility. Let's do an X-ray and MRI. Let's get you treated. Well, the problem with anything mental, behavioral, psychological is that it often feels so internal. It creates a big sense of isolation amongst firefighters, a sense that I don't fully understand what's going on with me. I know I need help, but I'm not about to go get it because I don't have a good read on this myself. Well, we've eliminated that because you can get in, and whether the issue is, social isolation or sleep or post-traumatic stress or depression or alcohol, you can quickly and easily, these take typically no more than 10 minutes, and it's anonymous. You can get in and answer some questions and get immediate feedback. Here's what's going on for you. Here's how bad it is, and here's exactly what you need to do about it. So it's very empowering to the firefighter, and we've gotten a lot of feedback that that's a real game changer is the word that people in the fire service use, because it empowers the firefighter. Now I understand what's going on. I understand what I should do about it. I can take action. Then we include a very robust, large wellness toolkit so that firefighters can get help with just about any sort of emotional or behavioral issue they may be facing on their own. If I want to work through this on my own, or if I just want to better understand the issues before I reach out to a professional, I'm able to access this very large library of resources. So this includes our audio casts, which are like audible books or podcasts, for example, that you can listen to on these different topics. It includes videos, it includes written material, all sorts of specific guidance on whatever issue you might be facing, such as suicide prevention for firefighters or parenting tips for firefighters specifically, how to save your marriage. If you're a new hire, everything you wish you could know about emotionally and psychologically surviving the fire service, or if you're getting ready for retirement at the other end of your career, how to healthfully psychologically prepare yourself for that transition to retirement. So firefighters are prepared going into that. So often they're carrying so much trauma into retirement. Now we're providing very specific, proactive guidance about how to make that transition. So of course we cover financial fitness for firefighters, emotional survival. We've got mindfulness and all kinds of different things. We just, for example, created a new exercise, and they're a critical incident grounding exercise. So when a firefighter has gone through a bad critical incident, they can pop in their headphones, they can hit play on this, and it helps ground them in the moment. Without having to wait around for something formal to happen, we can assist them right away. So this is the self-help part of the app. And like I said, it's constantly evolving, but it's very large and robust set of features. We include peer support and chaplain support. Peer support, of course, is critical. Now, very good chance your agency does not have peer support set up. That's okay. There's all kinds of resources we can put in there, and we can also point you in the right direction to get a peer support team set up so that when you do get one set up in the future, we put that peer support team in there. Now, if you already have a peer support team, we will put that entire peer support team in there. So they're just a push of a button away. We also put in chaplain support if your agency has chaplain support, or we can add it later. And the great thing there is suddenly you can access these resources in the time of need. Everybody knows where to go in the time of need. It's kept up to date. Push the number, and I can get a hold of the person when I want to. This also allows us to pool resources across multiple agencies. Oftentimes, the smaller fire service agencies will pool the resources together, and the app makes it so easy to reach out to peer support or chaplain support in an adjoining agency. We also have a very special feature called Crisis Alert. I've always been concerned about firefighters who are at that moment of need where they wish they could just get someone's help right now. And without even having to go through and select a peer support team member, for example, with Crisis Alert, I can push one button and I can get an alert out to get help I need from anyone who's available at that moment. So that's a very, very special feature. And then having this available 24/7 is key because we need our firefighters able to receive service at their time of need. I always say firefighters are there for everyone else 24/7. It's only fair that once the stress of that stacks up over time such that now they need support, we need to be available for them 24/7. Therapist finder is key. When a firefighter's at that time where because of family issues or sleep issues or suicidal thoughts, post-traumatic stress, anger, depression, whatever it might be, they need to be able to get a really great therapist, the best available. So in the therapist finder, what we do is we include only vetted therapists. And by vetted, we mean therapists that have been specially selected because they're the best available for that particular fire agency. We put the photos, profiles, notes in there. For example, Dr. Joel Fay, he's retired law enforcement, and he's a great first responder therapist. We've got a lot of therapists, for example, who are married to firefighters. They really get the firefighter culture. Then it's easy to reach out to them. You click the profile, the full profile comes up, one-touch dialing, one-touch map directions to get to the office. And a lot of the therapists these days, one positive effect of COVID is that they provide teletherapy for first responders. And that's through a HIPAA encrypted window that they can see right through the phone when that service is available. So that's a big deal, to have the right therapists and to have them available in the CORDICO Therapist Finder. We include a lot of physical fitness resources, such as yoga for first responders videos. Great organization if you're not familiar. We've got physical therapy videos in there from a physical therapist who's worked with firefighters for more than 20 years. So these are proactive, preventative videos guiding firefighters towards how to avoid common injuries. We've got nutrition guides for firefighters, sleep sounds to help sleep. And then we put in agency-specific resources. For example, if your agency has a workout program, exercise programs, physical fitness, et cetera, we build those all into the app. So it takes everything and consolidates it in one place. If you're a larger agency, this helps organize all your resources so that it's in one place 24/7, everybody can get a hold of it, keep it up to date. But if you're a small agency, you can go from very little or no resources to flipping a switch and suddenly having access to an extremely robust range of tools and resources. Push notifications are a great tool available in the apps. For example, if you have a critical incident, important upcoming events, exercises, when we launch new content, videos, et cetera, do app updates, we can alert people, pull them into the apps so that they know about these exciting updates. And one thing that's so important with technology is that it is a lot of work. So our team takes that on. We do all the design, implementation. We go to great lengths to assist with onboarding, and then we provide ongoing support. So we've got 5-star service team available, continually just provide ongoing support for these apps. And we routinely do content updates, additions, technology updates, et cetera. So that's all taken care of by our team. And one thing important to know about CORDICO is we are endorsed by top leaders in the fire service. For example, Deputy Chief Billy Goldfeder, who just won the 2021 Mason Langford Fire Service Leadership Award, one of the highest awards in the profession. He's a big fan of what we do. So congratulations to Chief Goldfeder on his recent award and recognition. Very, very much deserved, and really appreciate Chief Goldfeder in his service to the profession. But ultimately, what this is all about is I encourage you to think about how you can strengthen your wellness culture at your fire service agency through the use of technology. You know, whether it's by working with CORDICO or taking some other pathway, it's about connecting your personnel to confidential resources through technology, forming a peer support team, or if you already have them, empowering your peer support team with lots of tools and resources, helping firefighters through the most difficult parts of their career. Everybody is going to have times in this career where they're struggling, or they could use a helping hand. And this is about helping firefighters cope and get the help that they really need and deserve during those times. Of course, we know stress impacts decision-making, and we ask firefighters to make the toughest life-death decisions in split seconds. Let's help them relieve some of that stress in a healthy way so that they're in the best possible position to do that. And then let's support the department retirees and family members. We give retirees from the department, as well as spouses and significant others, access to these apps as well. I think that's really critically important. So thanks so much for all you do. We appreciate you. Very excited to share with you how technology is rapidly changing our ability to provide high quality, confidential, on-demand, 24/7, in-your-hand resources for firefighters so that we can break through the stigma, provide access to resources when firefighters need them, make it very, very easy for them to do that. And so hopefully the future of the profession will look very different than it has historically. in so many ways, including the ability to help firefighters in their moment of need with emotional and behavioral support resources. So thanks so much, everyone. Really appreciate you, and please enjoy the rest of the conference. Thanks so much. And if you want to learn more, www.cordicofire.com. Thanks, everyone. Bye-bye.
Hello, my name is Dr. Angie Moreland, and I'm an associate professor at the Medical University of South Carolina. And I'm also the co-director of the Center for Firefighter Behavioral Health. So our center is located within the Medical University in Charleston, South Carolina. And today I'm going to talk to you a little bit about our center as a whole. So what our mission is, what we've been doing for the past several years, and then go straight into some innovative treatment delivery strategies to help firefighters and their families, and also to assist people who are working with firefighters on an everyday basis. So our center, our overall vision is to improve firefighter behavioral health by bringing several technology-based, freely available, best practice resources for firefighters and their families. So our group developed or kind of started working with firefighters about 10 to 12 years ago. And we had here in Charleston, South Carolina, most people here are aware, there was a sofa superstore fire where 9 firefighters were killed in a structure fire here in Charleston. Right following that incident, a lot of partners from the National Fallen Firefighter Foundation and several other partners that work with firefighters and work with many of you here in the room today, and many people who are involved with FRCE, have all kind of helped us and worked with us over the years. So we developed then and first started applying for some grants and some projects to be able to help firefighters. And our main reason for that are a couple different reasons. First of all, firefighters in general, although they see they're faced with a lot of occupational stress, and they're at really high risk for a lot of mental health concerns, such as depression, anxiety, PTSD, marital concerns, substance use, a lot of different problems out there. Even though they are faced with many of those things, many firefighters either are not in need of professional mental health care or treatment, or they are not willing to seek that, either because of stigma, because of time and logistics, for multiple different reasons, which most people in the room here today would attest to. So the main reason that we kind of started was to develop some apps and to develop some self-resources that firefighters could access anywhere and at any time. So whether they're at the station, whether they're out in the field, if they're at home laying in bed, no matter where they are, they can access these resources and start receiving some help for mental health, behavioral health, or just kind of any type of stress that firefighters are typically faced with. So you can see our team is very committed to improving the lives of fire service members. And this has expanded to therapists working with firefighters and also to family members. And we're wanting to expand as much as possible to basically reach anyone that would be helpful to improve firefighters' life and to improve their well-being, especially on a mental health aspect. So why focus on first responders or on firefighters in general? So as we know here, they have a significant level of potentially traumatic events. Now, does everything firefighters are faced with reach the level of, a traumatic event that is going to result in PTSD? No, definitely not. But there are a lot of potentially traumatic events, and firefighters do tend to be faced with those traumatic events over and over and over kind of throughout the day. And that cumulative risk is a big thing. So as firefighters are faced with multiple traumatic events and maybe faced with things that are very close to their heart or very close in proximity to either their family members, reminding them of a trauma they've been in the past, or just really can be triggering for them, this can cause cumulative stress that can lead up to even more heightened mental health concerns. So firefighters are at increased risk also for physical consequences. So they're 4.5 times more likely to experience an occupational fatality, and about a fourth retire due to line of duty injury or occupational disease. And then the psychological concerns, the main reason we're here today. So why is mental health important among firefighters? So PTSD rates in the literature, what we found are between 17% and 22% when we look at different studies and different ways of measuring PTSD or of accessing firefighters, but that's compared to about 1 to 8% in the general population. So regardless of what the actual percentage is, we do know that firefighters are at risk for PTSD at a much higher level than the general population. And then about 10% of firefighters report current depression, and about 39% report lifetime depression. So that means that their levels of depression are heightened enough that it reaches the level of a diagnosis or of a diagnosable depression. And then 59% of first responders and firefighters specifically are faced with sleep deprivation. And why this is important is when sleep deprivation comes into play, that can exacerbate PTSD and depression and a lot of other mental health concerns. So you add that sleep deprivation onto it, and the functional impact becomes even greater for firefighters. So a huge thing with firefighters and mental health treatment, which I know we focus a lot on this at this conference, is that firefighters just are not likely to seek mental health treatment. And that's because of stigma, because of time, access to treatment, cultural considerations, and a lot of other reasons, like I said before. Also, traditional mental health treatment may not be necessary. So when we look at people who experience trauma, only about 30% of those, 30% develop a PTSD to a level that it needs to be treated in formal mental health treatment. However, that other 70% that are being faced with traumatic events may need some type of assistance to decrease symptoms or to increase well-being. And that's where a lot of the resources that we've developed really come into play. So we have a lot of different tools. I'm going to go through the tools today, but our tools were all developed with the help of firefighters. So my team, like I said, consists of clinical psychologists, therapists. We do have several firefighters on our team, people from our peer support team in town. But we also we've done multiple focus groups. We've traveled to many fire stations. A lot of people here in this room may have seen us in your location or heard from us to get feedback on our resources. So it's really, really important to us that everything that we develop, firefighters and firefighter families are assisting us from conception. So from the very beginning, even when we come up with our ideas of what we're going to develop next, it's with the help of firefighters, finding out what they need. There's really no purpose in developing resources that are not going to be useful. So our very first resource that we developed, this was about 10 years ago, and we actually are just now launching an updated version of this. So stay tuned for Helping Heroes 2.0. This is an 8-hour online training course, and this is designed specifically to train healthcare providers to treat depression and PTSD in firefighters. So the course has reached almost 10,000 professionals. So 8,800 was the last number that I checked. This is the site for it right here. And a really cool thing about this resource is that you can go into it. It's free to access, and you can see the different modules over on the right. So firefighter culture, assessment, psychoeducation, and then it goes through several different types of treatment that can be helpful to treat PTSD and depression in firefighters. And all of these, although these treatments are general, so they can be used with anyone suffering from PTSD and depression, this site helps to hone in on specific examples of firefighters. And we also have multiple videos in here that firefighters either contributed to or helped us to create. So they're actual real life scenarios that firefighters would have in a therapy session or in everyday life. Once you go in and you complete each one of these modules, it's kind of like a video game where then that level is open. So once you go through and complete the 8-hour online training course, and you can complete it at once or you can complete it in segments. Most people do not have 8 hours to sit down in their day and complete the whole thing, and that's completely fine. You have a username and password and you just go back in. So once these are unlocked, you can go in at any time and rewatch videos, download resources. There's a lot of examples of log sheets and manuals and things within this that can be accessible and may not be necessary right when you take the training, but then say 6 months later, you start working with a firefighter and you say, oh, wait a minute, there was this resource that could be very helpful. You can go back and access those resources at that time. So suicide among first responders or among firefighters specifically is that firefighters are at significantly increased risk for suicidal ideation, plans, and attempts. And that's actually kind of where we first came in to our work with firefighters was there were several initiatives very early on, about 10 years ago, to try to focus on suicide risk among firefighters and really try to increase partnership and increase awareness so that we can try to prevent suicide. So in the literature, we find that about 47% of firefighters report suicidal ideation, 19% a suicidal plan, and 16% have attempted suicide. And the higher rates are more associated with more years in service and perceived burdensomeness. So it really depends on how much the firefighter is being burdened and also how much mental health impact is coming into their everyday life. So to address suicide among firefighters, or at least to try and prevent or to bring awareness to suicide among firefighters, we developed our RIT tools for suicide prevention. This is just a snapshot of some of the pictures within this app. So this is an app. You can get it online where you see the link right there. And once you download that, then you will have it on your phone and you can always access it. And this tool is meant to be for suicide risk either among yourself. So a firefighter themselves can download this tool if they are at risk or they are having some increased mental health difficulties and maybe suicide. They do have some ideation. It has crossed their mind. It is also for risk in a friend or in a colleague. So right when you go on this first page, it says, who needs help? And it says, I do, or a friend does. It's very similar information within both modules, but it just kind of scopes it in a way either towards yourself or towards a friend. A major model so you can see in the middle column, that's just one of our pages that talks about common risk factors. And you can click on a lot of these different accordions so that more information will come out. On the right, you can see a big model that we focus on within our RIT tools is the ACT model. And this is act, care, and take. And we developed this based on feedback from firefighters saying that they are afraid to ask people about their suicidal thoughts, because if they ask, what happens if the person says, yes, I am having trouble? Then the firefighter says, I don't know what I'm supposed to do. So the whole purpose of this is to show firefighters that they should ask and then care. So listen and try to be a listening ear and be support, and then take. So it's not the firefighter's role or their responsibility to provide that mental health treatment, but instead to take the firefighter to somewhere where they can have that treatment. And this is one of my favorite video clips here. There's actually several clips, and it shows these are real firefighters and they came up with these scenarios, and it has different scenarios for if the firefighter that they're approaching, a friend, is okay with going for help. Also, if they're in denial, if they're combative and just do not want the help. So it shows some different scenarios and how you can handle those different situations. So our next tool that we developed was based on the high rate of stigma among first responders. So we know that there are very high rates of stigma for mental health services among firefighters. That's getting better significantly over the past few years, and mostly because a lot of the people in this room, but it's still there and it's still very prevalent and important to focus on. So because of cultural considerations, because of fear of occupational consequences, there's multiple reasons why that stigma is there. So this resource is called Firefighters Helping Firefighters. You probably recognize many people in these pictures down here on the left. And this is a storytelling resource that improves and provides peer education with a video library of over 250 personal stories from firefighters. So the idea here is for a firefighter to go in and hear about what stressful events were like, effects on loved ones, coping with stress, multiple different topics that these firefighters or firefighter professionals talk about, and someone can go in and hear from them. And it's really, we've heard that it's very helpful to reduce stigma because they're hearing it from someone that is like them or potentially from someone they even know. So we know that the role of EAP providers have a very important role. They hold assistance following incidents. However, there's a lot of stigma around EAP providers, a lot of because of experience and just because of not understanding what they do or having a bad experience with an EAP provider that did not understand firefighter culture. So this is our site called Navigating Critical Incidents. It's specifically for EAP providers, and it's a smartphone-based real-time app that helps EAP providers through screening, assessment, and an educational resource. Firefighters can access this as well and really hear about what some of those assessments will be like, what will it be like going to an EAP provider, and what will they receive. But then more importantly, EAP providers can go in and receive some knowledge about firefighter culture so that for those EAP providers that haven't worked with a firefighter, it can help to reduce that stigma because they will be more aware and the firefighter may perceive them as being a better resource. Substance use among first responders. We know that substance use can be a problem. 56% of first responders report binge drinking behavior and 14% report hazardous drinking behavior. So our substance use and misuse app is specifically to focus on that. So it's both for EAP providers and for firefighters, or really any type of provider. And it's to help identify, reduce, and prevent problematic use, abuse, and dependence on alcohol. And it says we'll be launching soon. That is incorrect. It has been launched. So please go access this resource. And then our most recent resource that we launched is that it helps helps family members who live with firefighters. So this app is specifically for family members. It focuses on spouses, kids, pretty much any of the immediate family that's working with a firefighter. And it's both to help support the firefighter, but also to support the family members. So there's a lot of sections in there. It provides support to the firefighter when it's needed, but we really developed this resource out of a call to action and just a lot of people, a lot of firefighters and a lot of family members as well, letting us know that family members need help too. They have their own behavioral health needs. They have challenges in parenting, challenges in home life, just a lot of different things that are very unique to firefighter families. And this app addresses all of those things. And again, has videos and resources and just a lot of information that can be downloaded for firefighter families. And then lastly, our newest program that we're working on right now is a certification for EAP providers who are specifically working with firefighters. So it's really to connect with EAP providers. And our purpose is to be able to launch this and have people receive a certification. So once people have gone through courses and really learned how to work specifically with firefighters, this will help them to be certified. And also our goal is to help firefighters and communities to link with people who have been trained specifically in working with firefighters. So coming soon, look out for that. So I'm going to put our information up here to say, if anyone wants to connect with us, please do. And just thank you for having me here today. I love working with this population and love working with all of you guys. So thank you.